Hello everybody, I'm going to talk about fluid, electrolyte, and acid-base balance today. This is a picture of Venus Williams. Some of you may remember her, a fantastic tennis player, and I can't remember all the story on her, but fantastic. But they just put her up as because she's a random athlete, and she knows that you've got to keep your water and electrolyte balance correct, or you're going to not do so well. Now, we studied in Anatomy 1 about you've got to have your water intake balanced with the electrolytes, or you'll get water toxicosis. Now, go to the next slide. Okay, the percentage of what is made out of water. Brain, 80%, teeth, 8 to 10, lungs, liver in the 70s, blood in the 50s, skin 70s, heart in the 70s, kidneys 80s, muscles in the 70s, bones only in the 20s. But a whole bunch of you is made out of water. This is showing a schematic of where some of this water is contained. This is a blood vessel. And in it you have blood cells, and in it you also have plasma, which is the liquid portion of blood. Now you have cells outside of the bloodstream, which are, they may be interstitial cells, they may be any kind of cell. But between those you have fluid. Some cells, epithelium is cell to cell, but most tissues have stuff in between them. And this is an interstitium filled with interstitial fluid. So water flows from the plasma to the interstitial fluid to the cell, back out, and stays in balance, hopefully. Intracellular fluid, interstitial fluid. These pie graphs are kind of easy to understand. A whole bunch of intracellular fluid. You have plasma, other fluid, interstitial fluid. And next slide. Extracellular fluid is going to have more sodium in it to start with. You may remember from the muscle physiology. I'm sure everyone remembers everything you ever learned in Anatomy 1. Isn't that correct? Huh, I can't hear anyone. Okay, the sodium-potassium pump is a classic example. And the muscle cells and the nerve cells is shown the most extremely in. Because as you have, let's just say a muscle contraction, you have a nerve impulse goes across it, and sodium receptors are opened, and they go into the cell. Lots of sodium goes into the cell. There's a sodium right there. And potassium leaks out. So you end up having a negative charge on the outside. And that's fine short term because you're just having a muscle contraction, but you can't stay negatively charged. You've got to get it back to normal. So all day long, there's this sodium-potassium pump. That's what some of your ATP, your energy from your food, is used for. It's picking up a couple of sodiums out of the cell, throwing them out, picking up a potassium, throwing it back in, and it just does this all day long. Okay, with a capillary exchange of stuff, fluids, but other stuff, the whole purpose of capillaries is to take oxygen and nutrients and good stuff out to the tissues and bring yucky stuff back into the veins to be disposed of. So you're at the beginning of a capillary, because it's coming right off the artery, you're going to have a pretty high pressure. So a lot of things are going to escape, be filtered out. As you get in the middle of an artery, you don't get any net filtration. And as you're getting towards the end, stuff starts coming back in, which is convenient because you want your CO2 and your leftover digested trash nutrients that you're not going to use anymore to put back in, to be taken where they can be disposed of. Of course, the CO2 will go to the lungs, the food products will go to the liver, as will drugs. Facilitated diffusion, again, we've talked about this before, but it's well worth a review. glucose molecules are the classic case of using facilitated diffusion. You have glucose out here. This is inside the cell. You can tell it's inside the cell because that's the cytoplasm. That says extracellular fluid. But the glucose, this is a glucose, I guess, it can't get in until it has insulin. And this is a carrier protein, and I guess that must have been the glucose. And the carrier protein catches insulin. I think of it taking it by the hand, and then it catches a glucose by the hand, and do-si-do your partner, and down the slot you go into the cell. Now, if you have no receptors, if these are gone, that could happen with, or they're decreased receptors. No, you'd be dead. Decreased receptors, you're going to have type 2 diabetes, and that's from overeating sugar, Coca-Colas, and getting old and fat and all the things that I just love to do. So, but we'll find out. I just had blood work done. I wasn't diabetic last time I checked. Okay, type 1 diabetes is you just don't produce any insulin to attach and bring these in, to attach to the carrier. So you have glucose, you have the carrier protein, but nothing to hold them together. And the insulin can be used over and over again, and the proteins can be used over and over again, but you still have to have a certain level. And this is your cell membrane. You remember, it's a double layer, biphosphate layer. Okay, this is showing a way that fluids can leak excess fluid out into tissues. This person got stung on the hand, say by a bee, and this can cause several things. Well, it causes an increase in capillary fluid escaping from the capillaries, and when you do that, it brings in inflammatory stuff, proteins, possibly clotting proteins, things that are going to help clean up and take out, like neutrophils and lymphocytes, maybe. Antibodies are going to be pulled into here. I found when I got stung by a wasp, it did all these things, and it also stimulated what I call the profanity reflex. The wasp stings, and out of the blue, for no reason, suddenly one sees profanity in the air. But of course, I would never do that. It must have come from the horse I was standing beside. Okay, thirst response. Thirst, you have osmoreceptors that are in your body, in your brain, and they are stimulated in the thirst center in the hypothalamus. So you have insufficient body in the water, decreases blood volume, decreases blood pressure, increases angiotensin 2, because that's supposed to help retain water and squeeze the vessels down. But anyway, we'll come back to that. It stimulates the thirst center, you drink more water taken in, problem solved. And if you're thirsty, your increased blood osmolality, that means you got more particles in the bloodstream. And that's going to cause osmoreceptors in your hypothalamus to be stimulated. And they're going to stimulate the thirst, and that makes you thirsty. You drink water, and you solve the problem. Also causes a dry mouth, and all these make you drink more. Okay, this is showing some hypothalamus and antidiuretic hormone. Okay, if you take a diuretic, what happens? You go pee, right? Right. Okay, so antidiuretic hormone helps keep you from going pee. So if your blood pressure is way down, you may produce antidiuretic hormone so that you'll, it's produced in the hypothalamus and then moved to the posterior pituitary. The pituitary is like 2 glands for the price of 1. And most of the things are in the, most of the hormones are sitting up here in the anterior. Posterior is just antidiuretic hormone and oxytocin. But antidiuretic hormone is released by the posterior pituitary. The kidneys retain water, and also arterioles are constricted. And this says affects social behavior in mammals. Only thing of social behavior I know of is this, hey, will you bring me a cup of water, please? That's all I know. There's probably something profound if one knew what it was. Okay, there's an aldosterone feedback loop. I don't know what that loop is about, but okay, aldosterone feedback loop. Aldosterone is released by the adrenal gland, which is called adrenal because it sits right here on top of the kidney. This is renal, is kidney, adrenal, it sits right here. It also releases epinephrine, which used to be called adrenaline. Okay, but it does a bunch of other stuff. Okay, if you have an increase in blood potassium, who knows what's going to happen to you if your potassium gets too high? YGD. Okay, what happens if your potassium level gets too low? Same thing. Who knows what that means? I do. You gon' die, and you gon' die now. If your blood potassium is too high, it's gonna kill you. If it's too low, it's gonna kill you. The biggest thing that I've seen where you have low blood potassium is patients that are getting Lasix or another diuretic, hydrochlorothiazide. They're excreting potassium, they're not taking in enough potassium, and it decreases radically, and it will cause them to have heart attack symptoms, and it's extremely bad. I mean, they will die, but either way, it will kill you. So this is a way to keep it from killing you from excess potassium. So aldosterone is going to be released from the adrenal gland, and that targets the kidneys, and the kidneys will throw potassium out. Easy enough. And sodium will be resorbed. So that normalizes sodium-potassium levels. Same thing if sodium-potassium levels, if the sodium levels fall. What happens if sodium levels get drastically, terribly too low? Right here. You gon' die. Now, I'm sorry, guys. I was raised in North Georgia in the hills, and sometimes it's hard for me to keep my proper English going just right. But you gon' die is what I would say. Okay, the blood sodium levels fall. Aldosterone, again, is released. Aldosterone targets the kidneys. It holds back, keeps sodium. And then you have a normalization of sodium potassium. And this is just, a release as needed. Now, there is one thing that you should know that's clinically very relevant. Your patients that have autoimmune diseases may be on a drug called prednisone. I bet some of you have heard of that. Systemic lupus would be a good disease for that. There's some skin diseases, I wish this would let me type. Prednisone. Okay. I still need two more letters, and I need an I dotted. What it does is it suppresses the immune system. That's a song. Prednisone. There we go. There. I think I have an eraser. Ha! Yeah, we'll get that fixed right now. There. Okay, that's pretty good. Now I'll just put my E back. We're good. Okay, prednisone is an anti-inflammatory, and it can be life-saving with things like systemic lupus because your patient will die. Unfortunately, it has a lot of side effects. The biggest thing that I see in my patients, dogs, is very few cats have I ever seen that have been on prednisone long term, but some of them have. But dogs are the biggest, and it's usually for chronic skin inflammation that's not caused by fleas. It's not caused by anything. It's just it's an autoimmune disorder. And you put them on prednisone, and they get cataracts. They get big old swollen bellies, and they also, which the patients don't know, are physiologically addicted to this drug. Now, I like to give it every other day, or even Monday, Wednesday, and Friday. And then the patients, if somebody forgets to give it, it's not as big of a problem, because you let the adrenal gland work one day, it has the next day off when prednisone works. Prednisone takes the place of cortisol and all of these adrenal gland hormones, except for epinephrine, and it probably has some effect on that. but aldosterone is just so essential to life. So I had a little case of dachshund and came in and they said he was fine yesterday. He was fine this morning. The dog is unconscious, laid over, low blood pressure, collapsed. I mean, it was in one of these you gonna die states. It was absolutely just about gone. So, got history? Well, yeah, I was giving him that prednisone, but I forgot to give it to him for about a week. Well, what happened to him? The prednisone had been taking the place of aldosterone. He started leaking sodium and water, and pretty soon he had such a low sodium level he was just about dead. So I hooked up an IV, gave him normal saline as fast as I could go, and gave him intravenous corticosteroid. I would have preferred one called Sodium-potassium, but instead I used dexamethasone because the clinic I was working in had it, and so we got to do what we have when we need it. It was amazing. Within 2 hours, that dog was walking. So if your patients are ever on prednisone, please tell them, don't get off of it. Don't run out of your drug. Get your drug ahead of time. Don't wait till the weekend. Keep it on hand. And then if you have to get off of it, you're going to have to get the doctor to get you a weaning procedure. And they've got to stick to it or it will kill them. I think that's all I had to say on this slide. Okay, we should have a next slide. I don't think it's going to do it. Okay, talking about, we've been talking about blood pressure and different hormones. Liver releases angiotensin into the bloodstream as angiotensin 1. Now, the kidney, if the kidney finds that it's not getting enough circulation, it will release renin into the bloodstream. Now, renin and angiotensin 1 get together, and also you bring in angiotensin converting enzyme. Then you have angiotensin 2 formed. Angiotensin 2 does a couple of things. It causes vasoconstriction. See, that's a vessel being squeezed. Just take your hand around there and imagine it's a balloon and you squeeze it. It increases the pressure. Now, it also causes aldosterone, which we've talked about, or we will in a minute, from the adrenal cortex. And aldosterone causes sodium retention and water resorption. So both of those increase blood pressure and get your blood pressure up to normal. Now, sometimes blood pressure is too high. So what you gonna do? I'm trying to get this light out of my eyes. It's crazy stuff. Okay. We've got things we can do about this if the blood pressure is too high. And this is huge. Okay, if we can attack this hormone, an angiotensin converting enzyme blocker, and lisinopril is the main one I can think of right offhand. And it's the most popular blood pressure medicine that I know of because of a very important reason. $4 at Walmart. At least it used to be. It may be up to $5 by now with inflation. It's very cheap and it works very well. It works too well for me, so I had to go to something more expensive, unfortunately. It prevents the ACE converting enzyme from being able to cause angiotensin 1 to go into angiotensin 2. With no angiotensin 2, the blood pressure drops. Okay, we also have angiotensin 2 receptor blockers. One of the older ones is losartan, and that's one I use because it's cheap and compared to the newfangled things. And it causes, you still get the angiotensin 2, but that doesn't work. It blocks the receptors on the vessels that can cause vasoconstriction. It blocks the receptors that cause aldosterone to be released, and it just basically lowers your blood pressure. And these are two life-saving systems. This by people finding out this chemical system right here, renin goes with angiotensin, which causes ACE to combine here, angiotensin 2, and that raises the blood pressure, gives you two places to interfere with that system. and it's saved more lives than just about anything. Because if your blood pressure gets extremely too high, you're going to die. We'll talk about blood pH. Now, for some reason, it wasn't in this PowerPoint what the normal human blood pH is. I thought that was weird. But between 7.35 and 7.45. An example of a really, really strong acid, battery acid, hydrochloric acid. These are strong acids. A strong base or alkaline, I think I probably should say alkaline because of the term alkalosis. Liquid drain cleaner is one. And you need to keep this blood pH right at normal. If it gets off of normal, you have problems. Okay, regulation of blood pH. And a lot of it has to do with CO2 and removing CO2 from the blood or keeping it in the blood. Now, what happens with CO2, and I may have this written on another page, CO2 dissolves in water, CO2, and plus water, H2O, it gives you carbonic acid. And it gives you carbonic acid. That's probably on the next slide, but I'll just write acid. So, what happens when you breathe real fast? Everybody breathe real fast till you faint. No, don't do that. Change my mind. Okay, CO2. When you breathe fast, you blow out more CO2. When you hold your breath or don't breathe fast, you retain CO2. So acidosis and alkalosis are one of those YGD things. You gonna die. You gotta have, it's gotta be right. And your body will take care of this normally. So with acidosis, you've got pH too low, and I believe I have something on the next slide that goes into this more. Stimulates receptors in the brain and in the arteries, and this causes an increase in respiration rate. Now, that causes you to decrease CO2, which causes you to decrease carbonic acid because water mixed with CO2 gives you carbonic acid. And by doing that, you had an acidosis, you're going to raise the pH, so it's going to go towards more alkaline or more towards normal. So homeostasis is restored. Yay, body saved again. Now, if you have an alkalosis from whatever the cause, stimulates brain receptors and arterial receptors, this will decrease the respiration rate. When you hold the breath, decrease the rate, it increases the CO2, which increases the blood bicarbonate because water plus carbon dioxide gives you carbonic acid, and acid decreases the pH. Okay, we talked about acid and base a little bit. We're going to talk about the types of acidosis and alkalosis. They come in metabolic and respiratory, both alkalosis and acidosis. If you keep this little formula in your brain, you can never forget this and you'll remember the whole thing. When carbon dioxide mixes in water, it gives you carbonic acid. I would have put this up as a formula, but I couldn't make my computer do it. It wouldn't do the arrows. So if you can remember that, you can remember everything. So let's start with respiratory acidosis. I'll go a little bit backwards. You got your patient too deep. They're not breathing out enough. They're accumulating a lot of carbon dioxide. When they do, they get carbonic acid and they get respiratory acidosis. Your pulse oximeter is probably going to look great. They're not going to die from lack of oxygen because you got them on pure oxygen and it's just going to work great. The problem is that they're getting acidotic and they'll die. Okay, metabolic acidosis, two things that I think of. Well, it's all the same ketone bodies. Ketosis of any cause releases ketone bodies, which are acid. Now, when someone comes in to see you and they've got a blood sugar of 500 and you have to dilute it to really know what it is because your machine won't even read that high, then you're pretty sure they're diabetic. Well, their cells are starving to death. Inside the cells have no energy, so they start breaking down fat so they don't just starve completely to death. They break it down so fast that they get ketones released and they're acidotic. And you've got to get that acidosis down. Yeah, the glucose being so high is going to kill them eventually. But what's going to kill them now is this acidosis. So you got to get that down. You're going to have to put in, your IVs are going to be going. You're going to be pushing bicarb. And also your IV will dilute out some of this sugar. Now, metabolic alkalosis. Vomiting. This can be from being sick. Little babies that get sick and vomit can get very sick and die of alkalosis. Bulimia causes it. And actually, somebody famous that was on a ventilator for years and years and years on artificial life support that they were both anorexic and they also were bulimic. And she had vomited so many times that she had metabolic alkalosis to the point that it gave her a heart attack, and she was essentially brain dead, but her family insisted on keeping her on life support for years and years and years and years. She didn't know the difference, but it was really awful on the family, her husband, just a lot of people. So vomiting of any cause, and I believe there was a test in some test bank, and it could come up on your test, that if a baby vomits too much, they could have problems with metabolic alkalosis. Now, respiratory alkalosis, hyperventilation, your football game. I remember when I was senior in high school, we had like 3 years without winning a game. This is my senior year, and here comes the running back, catches the ball, and he wasn't but 5'4", but he could run. If he ever got a hold of that ball, I mean, that man could run. They stole him off the track team. And this was back in a long time ago, and he wore those real high shoes like they wore back in the 70s and 80s. We'll say 80s to make you think I'm younger. But he wore those high shoes, so I didn't realize how short he was till I saw him barefoot. But anyway, he could run and nobody could catch him. So he was scoring a touchdown. He did a 60-yard run. People are jumping up and down and screaming. Well, the guy next to me just passed out, unconscious. We're trying to call ambulances and all that. They get there and they said, he hyperventilated. Get him to breathe into a paper sack. And what that did was let him rebreathe some air, that's kind of out of vogue as a treatment now. And what's very out of vogue that happened apparently in one of the high schools we served was some physician actually put a plastic bag over someone's face that was hyperventilating. Not a good idea. And also, when they're having acidosis or alkalosis of any kind, it could affect their respiration. Okay, now, symptoms you may see just to give you an idea of what kind of acidosis or alkalosis you have. Central nervous system, headache, sleepiness, confusion, loss of consciousness, coma, death. Respiratory system, shortness of breath. Now be cautious about abbreviating that on your notes, because to me, when I see the abbreviation for short of breath, I don't think of the same thing that you're thinking of when you write that down. I just write dyspnea. Coughing, heart arrhythmia, increased heart rate, seizures, weakness, nausea, vomiting, diarrhea. The vomiting may help if they don't aspirate because they're getting rid of acid. Alkalosis, confusion, lightheadedness, stupor, coma, so they may seem kind of the same. They're confused, they pass out. Peripheral nervous system, tremoring, tingling, hands, face, feet, muscles, twitching, spasming, digestive system, nausea, vomiting. And so they can be similar in both, but you can do a blood test and you know for sure which one you have. And I believe that is all.